Friends of the media, thank you for coming to the press conference. The Chief Executive will say a few words and then we'll take questions from the floor. First, the Chief Executive. Friends of the media, members of the public. Earlier on, I quoted the statement of the World Health Organization. It says that as there's further development of the epidemic, the prevention strategy and measures to stop the epidemic may have to be adjusted accordingly. The work that the ASEAN government has done is in line with this view. That's why on the 28th, the 25th, the 28th, and the 31st of January, I have announced various measures to fight the disease. That's because we've been monitoring the developments of the epidemic, and then we've considered other factors, and we decided to make adjustments. The aim is to stop the spread of the disease. Just now, the Center for Health Protection of the Department of Health gave you an update. As of today, there are still 15 cases of confirmed cases. Today, I and my colleagues are going to announce further measures to prevent the spread of the disease. Now, in this strategy, in this fight, the experts have told us we need to resort to containment. One measure is to stop, to reduce people movements across the border, because the epicenter of the epidemic is in Wuhan and Hubei province. So that's why we try our very best to reduce the people movements across the border. And this two-prong approach. First is we target the source. That is for people who have visas to come to Hong Kong for work or for leisure. So by tackling the issue at source, that means we will stop the issuing of such permits. So with the support of the central authorities and the Guangdong government, the relevant authorities have stopped issuing visas to Hong Kong, endorsements to Hong Kong. That includes endorsements for tour groups, individual visits, and the one visit per week visit for Shenzhen residents. And also, all business visas have been stopped. That's so that tackling the issue at source. The second approach is to substantially reduce the number crossing the border. On the 30th of January, the ASEAN government has suspended clearance service at 6 boundary control points, and then we could see the significant effect of that. So before the implementation of the measure, that is the 29th of January, and then we'll compare the figures then to the figures yesterday after the implementation of the measures. Now, for all move and arrivals across the border, excluding the airport, before the implementation of the new measures, 170,991 arrivals. After the implementation of the control measures, 73,019, so a drop of 57%. And then we look at the different types of arrivals. For Hong Kong residents, again, coincidentally, the drop is 57%. For mainland residents, the drop is 62%. For other travelers, 49%. Now, some are concerned about mainland residents coming to Hong Kong. But actually, yesterday, there were 7,066 arrivals. Why do we focus on the cross-boundary, the arrivals? Because as the Department of Health has been saying, our greatest concern is about arrivals, because we are afraid that disease could be imported from the places with the outbreak. So that's why we focus on arrivals. But then for Hong Kong, the situation is unique. We also concerned about Hong Kong residents going out of Hong Kong. Now here we're talking mostly about land crossings and the ferry crossings going to the mainland. We believe many of them who've left Hong Kong will come back. They may come back the same day, or they may stay for a short while on the mainland and come back. So, therefore, again, let's compare the figures. Before and after the implementation measures for these departures, excluding the airport again. Before the implementation measures, 42,766 departures. Yesterday, there's still 31,771 departures, so a drop of only 26%. Now, we've reviewed these figures, and the measures only came into effect on the 30th of January, so they've been in place for just 4 days. Now, we look at the public health angle, the control of the outbreak angle, and we're seeing that there's still some 76,000 people entering Hong Kong. And then every day there are still some 30,000 plus Hong Kong residents leaving Hong Kong. And as I said, after they leave, they will come back again. And therefore, they may still cause concern because there is risk of them bringing back the disease. That's why, for this reason, we are announcing further measures to ensure there's stringent control of the boundary control points and reduce the people movements across the border. Now, so we're still going along the same line in the measures we announced before. So today, I'm going to announce that for all land crossings and sea crossings, there will be just 2 boundary control points. That is the Shenzhen Bay BCP as well as the Hong Kong Macau Bridge BCP. In other words, we're going to suspend the operation of the other 4 BCPs. That's Lo Wu, that's the railway crossing. The Lok Ma Chau line is also a railway crossing. And then Huanggang and the Macau ferry terminal. So this will come into effect from mid-0 hours tomorrow. So people who wish to use this crossing, they have to use them before midnight tonight. So that means after we implement these measures, there are just 3 control points left. One is the Hong Kong International Airport, one is the Shenzhen Bay BCP, and the last one is the Hong Kong Macau Bridge BCP. So there's a substantial reduction in control points. And with such measures, we're going to adjust the transport arrangement. For example, there will be further reduction in flights between Hong Kong and the mainland. And also after consolidation of the boundary control points, because there's no public transportation, so we will see a continuous slide in the number of arrivals and departures. The SL government will continue to monitor closely various situations, including the developments of the disease and the number of arrivals and departures. If necessary, we will have no hesitation to implement further measures. And such measures may include requiring all people coming through the borders to go into quarantine. Right now, the measure only applies to people, residents coming from Hubei province or Hong Kong people coming from Hubei province. But if we need to step up our measures, then we may have to take this step. So that's why today I must also make it clear that in this effort to fight the disease, there is a need for adequate quarantine facilities, including home quarantine measures. And then the HA will also have to activate certain designated clinics. These are important measures to take. And here I would like to appeal to all district councillors and residents not to oppose such move. The government is still working very hard to look for facilities, but every time when we identify a location, when we announce a facility, or before we even make the announcement, we are already met with strong opposition, and there may be even rampages. Now, this time round, as I said, we are taking strong steps to control the borders. We have a total of 13 boundary control points. We're now closing 10. And last round of measures have been effective from the figures I shared with you. We've been able to reduce people movement. And then in a few hours, the latest round of measures will come into effect, and that would substantially reduce the flow of people further. And as you see, we are acting very fast because we're monitoring the situation very closely, and if necessary, we will have no hesitation to take further steps. Now, we need to stand united in fighting the disease. We need the recognition of the public in such effort. Now, with any public health issue, we always need the support of the community. We need the cooperation of the people. Here, I would like to make a number of appeals. First of all, I strongly advise the people of Hong Kong to refrain from going to places where there is an outbreak, including the mainland, unless it's absolutely necessary. And here, I would also like to appeal to you to listen to the instructions given by the Center for Health Protection. We need your full cooperation. Now, we could be talking about instructions for the general public, or because of health assessment, there is need to issue certain directives, and I appeal to all involved to fully cooperate. The third appeal is that for suspected cases or for confirmed cases, please give your full travel history and contact history to the Center for Health Protection so that the government could trace the parties involved. This is a very important aspect of health protection. If someone is not honest with such history, it is actually against law, and we will strictly enforce the law. The fourth appeal to the general public is that please try to stay home as far as possible. Please do not go to crowded places. But of course, is because you don't need to leave home. But if it's necessary for you to leave home, then of course there's no choice. And then please make sure you take all the personal protection steps. And then the next appeal is that for any disease outbreak, then the public health measures, they may have an impact on employees going to work. So I would like to make a sincere appeal to all businesses. This is a time for us to work together to overcome this challenge. Please be considerate to your employees because their community may be affected during this challenging time. Finally, I would like to pay my tribute once again to the healthcare workers who are still doing their job, and then they're putting the health of the people first and foremost. So the government will also give top priority to the resources required by the healthcare workers. We'll make sure that protective gear and supplies are ensured for the healthcare workers, and that include, of course, masks and so on. And when necessary, the SAO government will make the appropriate arrangement. Thank you. The floor is open to questions. If you wish to ask a question, please raise your hand. Please identify your organization and then speak into the microphone. The one in red. I'm from Wenhui Powell. Now, you're reducing the number of boundary control points. Is it related to the strike of healthcare workers? The second question is that when healthcare workers strike, are they showing disregard to the lives of the public? Would you appeal to healthcare workers not to go on strike? And for those who have gone on strike, would they be disciplined? Now, today we have announced further measures to further control the boundary control points and reduce the flow of people. It's in line with what we've been doing all along. It's just that we are taking further steps. It's because of the latest developments in the outbreak now, and that has absolutely nothing to do with the 5-day strike that healthcare workers started today. If anyone thinks that by resorting to such extreme measures, the SL government or the hospital authority will be made to do something that's not rational or something that will only harm the public, no, they are not going to get anywhere. For the second and the third questions, I will first invite Dr. Kuo of the hospital authority to speak, and then as the Chief Executive, I will tell you my views on the actions of certain healthcare workers. Dr. Koh, please.
We learned that medical staff, especially those in the trade unions, would like to use strike as a mean to express their opinion concerning prevention of the disease measures. I disagree with that. The opinions are we don't have much opinion with their views, but I don't agree with their ways of expression because strikes will affect our health system. If any colleagues is on absence on duty, TMHK has well-established guidelines on human resources. Of course, it differs for every case, but we will follow up on every case.
Let me say a few more words. I fully appreciate that for healthcare workers, they are at the forefront in this fight against the disease. They are under immense pressure. So that's why I said just now, I would like to express my heartfelt gratitude to healthcare workers. I have great respect for them. And as far as we could manage, we will give top priority to healthcare workers for the supplies and resources we could get hold of. And I'm not just saying it today. We've already issued a directive. The whole government is fully aware that we must give top priority to the needs of healthcare workers, especially with protective gear. Second point, how to reduce the pressure on healthcare workers. We share the same objective. We believe we should reduce people flow across the border so we could cut out the transmission channel of the disease. And we've been working in that direction all along. Every time when we see there's need to do more, we are doing more. But maybe we may not resort to certain means as advocated by some. As I said, we have to look at the overall interests of Hong Kong, and also we need to look at the needs of certain residents in Hong Kong. The third point is since we share the same target, then we should work together to fight the epidemic. Now, this is a critical time, and then extreme measures are taken. And such extreme measures will inevitably affect the interests of patients. And then for the management of the hospital authority, which is already under great stress, it will only add to the stress. Therefore, I must say I really cannot approve of such actions. Now, in the past day or two, I've received a lot of messages from people, in particular frontline hospital authority staff. They say they don't approve of such actions, but then they've asked us to consider further steps to be taken. That includes Professor Yuen Kwok Yong and Professor Gabriel Leung. We've been moving in that direction. We're just now, making the measures stronger. Now, and this is some tactic that smacks of political consideration, and we believe it really doesn't help protecting public health and our fight against the disease. Thank you.
I'm from our FA. The strike of medical staff is to urge for complete closure of our border control points, but now you are only closing 2 of them. What is the estimated inbound travelers every day? If we don't close off the border completely, more pressure will be put on those 2 border control points. There will still be 70,000 visitors. The CE said if we close the border points completely, it will constitute discrimination. And about stringent enforcement concerning those cases where patients have concealed their medical history and even escaped from hospitals, will you do anything to punish them? And there are news that CSI masks have leaked to the market, and some citizens have got hold of these masks, but medical staff are having a shortage for masks. How can you make sure that every medical staff has mask? About the first question, what we are doing is always in line with our strategy for prevention and containment of the disease. So there is no such case of what you mentioned about changing directions or position. It is only about taking further steps. We are closing another 4 border control points. We have taken very drastic steps. I believe that we can achieve the purpose of cutting down visitors. But I cannot give you an estimation of the number to be reduced, because if someone has the need to cross the border, he can choose other control points. Now there are Shenzhen Bay and also the Zhuhai Macau Bridge control points left. We have closed all the border control points with railway connection in Luowu and the Lok Ma Chau branch. So on the 29th of January, before the measures have come into effect, comparing the figures with the latest figures, we have seen a continual reduction in visitors' number. Actually, the number of visitors have been decreasing all along, especially when you compare the number of visitors on the first day after the measures have come into effect. The number have dropped drastically. The visitors are being pushed to other control points, or even they stop crossing the border altogether. So with the closure of the 2 additional borders with railway connection, visitors using railway as a means of transport would be discouraged. Now we have also closed the Hong Kong-Macau ferry as well. So the linkage between Hong Kong and Macau, there's only the Hong Kong-Zhuhai-Macau bridge left. So these measures are in line with our strategy. As I said, when there is the need, we will carry out the measures. That's why I made an appeal or advice. If you think that you can conceal or give an untrue version of your history to our medical staff, well, when necessary, we would definitely employ all means available to hold them to account. A few days ago, the Chief Secretary has addressed you on the issue of mask supply. Honestly, actually, mask supply is in shortage globally, and for certain places, there are even a limitation on the number of exports. When we are carrying out our procurement efforts globally, we have difficulties securing masks, even if we have the money to pay. So this is not a local problem, and this is not something that can be addressed in a short period of time. Everyone is concerned about the disease, and everyone needs a mask. So the supply of masks will be in further shortage globally. Back in the days when Hong Kong has a thriving manufacturing industry, masks was not a popular commodity to produce. Now we have the correctional services industry to supply masks for us. We are encouraging production from them. We have been procuring new machineries for the correctional services department to step up production of masks. So the 2 local production line of masks would fall far short from meeting the demand of masks in Hong Kong every day. it is really difficult to ensure enough masks for everyone. But we will try our best to meet medical staff's demand. We don't have much in our stockpile left. We care about our residents very much, but when fighting the disease, we have to ensure that our frontline medical staff has enough supply of masks when they are treating our citizens. As for whether there is the situation of masks produced by the CSI leaking into the market, we will carry out investigation into that.
Thank you. John Ray from ITV News of the United Kingdom. Forgive me, Mrs. Lam, asking you in English. If you could reply in English for my audience, it would be great. Can I ask you this? Why haven't you closed all the border crossings? You know, an open border is an open border, and the longer it remains open, the greater the danger to the people of Hong Kong. Isn't that the truth of this?
Well, in answering your question, John, you have to understand that the situation between Hong Kong and the mainland of China is almost unique. Over the years, we have established very close relationship. I don't mean the government-to-government relationship, but it's a relationship between the two people, the two economies, the two communities. So there is a huge demand, I suppose, a huge legitimate demand for that sort of cross-border travel. And that's why I'm quoting you figures that there were indeed more Hong Kong people crossing the border almost on a daily basis, and then they have to come back. So the purposes, as I could understand, will include work. I'm sure you have come across people who work in Hong Kong, live in Shenzhen, or who live in Hong Kong and work in Shenzhen because of the technology industries and so on. And there's also a demand for looking after young family. I'm sure you have also heard about we have a large number of children who have the right of abode in Hong Kong, but their mothers do not have that right yet. So they may have to cross the border on a frequent basis to look after their children. And then we have the supply of food and other necessities. Although, of course, we are keeping the cargo clearance open, but there's a lot of logistics involved that require people to cross the border. I can continue to give you examples of this very legitimate and genuine cross-border traffic that we need to handle. Otherwise, we will end up with more troubles for the operation of this city and also for the 7 million population of Hong Kong. So our strategy is really to consolidate as much as possible the existing control points. Now it's really down to, excluding the airport, there are only two. One is the Shenzhen Bay, the other is the Hong Kong-Macau-Zhuhai Bridge. And the additional benefit of doing that is we are channeling all cross-border traffic into these two cross-border control points. And because of the inconvenience that we have caused to people as a result, so the numbers will come down. And I have proven that the numbers have come down. The second merit is we can then concentrate the people, I mean the staff. We can release a rough estimate of about 1,000 civil servants from the other control points to be suspended operation into these two remaining open control points. So they can do much better medical surveillance, inquiries, temperature check, and so on, in order to fulfill that same purpose of infection control. So this is really a sort of balance that one has to strike, given Hong Kong's very unique situation. But as I said, this is not the end of our strategy or our efforts. We will continue to monitor the situation and take whatever necessary steps to protect Hong Kong from this infection.
One more English, please.
Hi, Locke from SCMP. Mrs. Lam, you just said that some of the demands made by the medics that are currently on strikes are irrational. Actually, they have two demands for you. One is to maintain a steady supply of masks to Hong Kong, and the second being that to impose a ban for travelers coming into Hong Kong from mainland, regardless of origin. Can you make clear on which part of that is irrational? Second question being that You said that excluding the airport, you will be channeling traffic, cross-border traffic between Hong Kong and mainland into 2 ports. But actually, seeing from statistics from the immigration department, actually, the airport accounted for over 5,000, over 4,000 travelers from mainland in the past 2 days. Will that remain a loophole in your measures against the new virus? Will more port health measures be put at the ports that remain open to make sure that people coming in are healthy and fit? Third question being, on mask supply, you said that the government cannot release the masks made by inmates to the public, but we have seen reports that it had somehow made it onto the market. Can you explain how these masks produced that are for internal consumption has made their way into the market? Thank you.
Well, I answer the third question first. As I have mentioned, as far as I could gather, the masks produced by the Correctional Services Department under this arrangement of CSI should be for government use. Whether government use also includes some public sector use, I have yet to find out. But they should not be sold in the market because they have very stringent requirements. The SVRS could also supplement. So I couldn't explain why they have gone into the market because this is an anomaly. So we have to find out and to investigate if need be. So that is my simple answer. The second question about airport. Airport, of course, is a very important control point. And airport services not only travelers from mainland, but from all over the world. And it is very important for Hong Kong to keep the Hong Kong International Airport open for both passengers and cargo. For the category of mainland visitors coming in and out at the airport, one has to differentiate between those coming from abroad. So they are not coming from an infected area per se. They are coming from abroad into Hong Kong. So this group should be of no difference to other international travelers coming into the Hong Kong International Airport. But we still have obligations to ensure the safety that you have mentioned. So at the airport, it is really a very important control point that we have introduced the more stringent measures at the very beginning, including the latest arrangement based on the WHO advice to do exit screening. Because normally the health authority is less concerned about exit, but more concerned about entry. But on this occasion, because of our airport and the international connectivity, so we have been doing exit screening for passengers leaving Hong Kong at the Hong Kong International Airport. But if there are mainlanders coming by plane to the Hong Kong International Airport, without even a very explicit policy, I'm sure the numbers will come down because the frequency of the flights is coming down significantly. Last time when I shared with you what we were doing, I said that the Secretary for Transport and Housing has been liaising with the airlines and the authorities, and the then target is perhaps to half the flights per week between Hong Kong and mainland. I'm sure Frank would say the latest development, because of different things happening, that this frequency may be further reduced. I answer the first question and then invite Secretary for Transport and Housing to say something about aviation. Now, as far as the union in the hospital authority starting their 5-day strike today, of course, they have several demands. That's why I said if you look through the objectives of what they want to do, we are not so different. The objective is to protect Hong Kong and to lessen as much as possible the workload at the hospital authority and the chances of being infected. So if you ask me to comment individually on their demands, I have no problem with their request that we should try to ensure a stable supply. We have been doing it for quite some time, but I'm explaining to you the difficulties because there's a global demand for these protective gear and equipment. We are doing worldwide search. We are calling up even individual suppliers and industrialists who have plants all over the world to see whether they could help to give Hong Kong a needed supply. And I can assure you that money is not an issue. We are not asking for competitive tendering. Whoever has a supply, as long as it fulfills the specifications according to the Department of Health, and they can be sent to Hong Kong, there will be direct purchases by the government logistics department. But the difficulties are very real. So while on the one hand, I accept and admit the need to ensure a stable supply, that is not something that I could promise without conditions, because they are not locally produced. They have to come from overseas. Now, finally, is this demand in their list of demands is about a complete closure of the borders I have just explained to John. So it's the same answer. As far as a ban on travelers from mainland, you have been given some of the figures. In terms of numbers, and by the way, when it comes to infection control, when it comes to a virus, there is no boundary. So you cannot differentiate that people of a certain race, of a certain nationality, of a certain residential status, or holding a certain travel document are more prone to infection than other people. So we have to treat them equally. As long as these people cross the border from an infected area, say from mainland, they have the same risk. So we treat them similarly. And in terms of numbers of people, the Hong Kong people returning to Hong Kong or arriving in our control points, the number is much bigger than just talking about mainlanders or other travelers like American, Japanese, or French. So the question is, by consolidating the control points, making it very inconvenient for people to cross the border, we hope and we have demonstrated that it will bring down the numbers. But I do not rule out further measures as the situation evolves. Frank.
Thank you, Xi. Well, as we have explained to the Consulate General Assembly yesterday, because, as a member of the global community, flight connection between cities is a very important link, for people to travel from one country to another. And therefore, at the Hong Kong International Airport, we have done everything we can. For example, for every passenger arriving at the Hong Kong International Airport, they would have to go through the health declaration process. They would have to go through the thermal screening to see whether they are fit to be admitted into Hong Kong. And for passengers going overseas, they would have passed through the thermal exit screening as well, including those who take transit at the Hong Kong International Airport, whether they are coming from overseas to the mainland or from the mainland to overseas countries. So as one of the busiest airports across the globe, we have to discharge our responsibility as a dependable and trustworthy international airport. So we have put in places all kinds of scanning equipment, including handheld equipment, so that every passenger departing Hong Kong would have been scanned individually, and making sure that everyone is safe and sound to travel. And as you would have noticed, there was a ban from Vietnam to suspend, flights between Vietnam and Hong Kong. But after our explanation to them, informing them the mechanism and the procedures and the robustness of our screening processes, they finally allow flights to resume. And we are also talking with the Italian government with respect to the passenger flight ban. And I talked to the Consul General yesterday, and he promised to write back to the Italian government, explaining to them the kind of measures we have adopted in Hong Kong. And hopefully, I hope they will give us the kind of green light to go ahead in the near future. So I hope I have explained enough why we have to maintain international transport for Hong Kong people, for overseas visitors, and for anyone who travel in and out of Hong Kong and transiting Hong Kong. Thank you.
既然陳局長提到我哋昨天
Well, Mr. Frank Chang mentioned our meeting with the Consul General yesterday. I would like to say a few more words on that. Now, since the WHO made this statement, we noticed that there are certain foreign governments have introduced certain measures on flights. So we look at each and every measure and see how it affects Hong Kong residents. Now, maybe there could be more governments who do not have enough understanding about our work here in fighting the infection, and they may therefore adopt certain measures. So to prevent that from happening, we arranged to meet with the Consul General, all the Consuls General in Hong Kong, with the Italian Consul General, and they fully understood our position. And I've also written to all Consuls General in Hong Kong. We've explained to them the work we've done since the start of the outbreak. Because we're concerned there may be Hong Kong residents overseas because of these measures of certain foreign governments, or because we closed the border, they're not able to come back, they're stranded in other places. That may lead to a host of problems. So with this consideration, we will intervene at once whenever there are certain measures. Now, for example, the Filipino government also took certain measures, and a large number of foreign domestic helpers in Hong Kong may be affected. That's why I've asked the Labour Department and the Immigration Department to see what they can do. Let's say there are foreign domestic helpers whose contracts have expired and they're not able to go back, so they'll be stranded here. So we are trying to help them in a compassionate manner. Because of problems of international travel, so we will see what we can do to help those affected. Another measure we're going to take is that there is type of endorsement called family visit. We know that most of these cases involve mothers trying to come to take care of children, mostly mothers. And these mothers do not have right of abode in Hong Kong. So either they come to take care of their children, or they have to bring their children back after visiting the mainland. Now, if we do not allow such mothers with two-way permits to cross the border, because we've totally closed the border, so they can't take care of the children, it would be a problem. That's why the Director of Immigration will exercise discretion. So maybe the period of stay will be extended for such cases, so then the mothers don't have to keep crossing the border to take care of children. There are plenty of such cases. Friends of media and members of the public, you have to fully appreciate this. We do have very close contact with the mainland, and there is, there are many exchanges between Hong Kong and the mainland among the people. So if we take, we go for complete closure, it would affect many people. But what we're doing now is to try to reduce the number of boundary control points. At the same time, we see if there are other measures we can take, so to reduce the need to cross the border. Thank you. Last two questions. The one in red, please. Good evening, Mrs. Lam. I'm from TMHK. Why is it that so far you would not impose restriction on mainland visitors coming to Hong Kong? Now, as the Chief Executive, do you really must stand against the people of Hong Kong? And then from the Immigration Department's figures yesterday, for mainland arrivals through the Hong Kong-Macau Bridge and Hong Kong International Airport, they accounted for 60% of the arrivals, and that the most people came through Shenzhen Bay, 2,200. So how come you're still leaving this open? Third question, we are seeing local in transmission cases, and so you are closing certain more border control points. So have you missed the golden opportunity to stop the spread of the disease? Last question is on masks. Do you know many old people have to get up at 4 in the morning to queue up for masks, and they may not even succeed in buying the mask, and then they waste the mask because they have to wear one to go queuing. Now, does the CSI have producing masks? In the past, they have given masks to certain organizations, and so if that's the case, Why don't you give priority to distribute masks to the elderly at, say, the Home Affairs departments, outlets, and so on, so they don't have to queue up early in the morning for masks? First question. As the SAR government, I and my team always take care of the needs of the people of Hong Kong. We also take care of the overall interest of people of Hong Kong, so I have great reservation with your choice of words. Definitely, we will not stand against the people. But so we have to look after the overall interest. That's why in my reply to the 2 questions in English, I've explained why we are adopting these measures to strictly control the BCPs and reduce the number of BCPs, so we could carry out infection control measures at the remaining borders. Because, as I said, there are Hong Kong people who do have a need to cross the border. I gave you figures about the 100,000 people entering and leaving Hong Kong. They are Hong Kong residents. So for these 100,000 Hong Kong residents, is it the case that we could just disregard their needs or their interests altogether? Interest is not necessarily about money. Please observe order. Please let the Chief Executive finish. I've said this many times. In infection control, there's no regard to nationalities, races, or the types of travel documents people hold. We have to treat them equally. Please, please, please do not interrupt the Chief Executive. The Chief Executive will answer your questions. Please. Please, please remain quiet. About this entry issue, I've explained it many times, but I hope you will appreciate this. We need to take care of the Hong Kong residents who have to cross the border every day. And here we are also giving strong advice. Please do not cross the border when there is not such a need, because by doing so, they are affecting our infection control work. But then for visitors, mainland visitors or other visitors coming through this border, we're treating them equally. We have strict control. Now for the Shenzhen Bay boundary control point, is that the busiest control point. From my recollection, that's not the case, but perhaps the Director of Immigration could supplement. But then why do we choose certain BCPs? We choose certain BCPs to make it inconvenient for cross-boundary travel. That's something we rarely do. Usually we try to make it convenient for people, but in this case we're trying to make it inconvenient for people. For the Lo Wu crossing, for instance, and the Lok Ma Chau crossing, people could go there by train, so it's relatively accessible. But for the Shenzhen Bay control point, it's not so accessible. Now, if we close the other control points, and we don't know what people will do. Maybe if they find it inconvenient, they won't cross the border. And if they don't want to go to the Shenzhen Bay control point, they may just delay their travel, and that's something we would like to see achieved. And also from the public health angle, when people are in enclosed space like a train car or other public transport, and then people, if they don't wear masks, it could be a problem. So that's why we have suspended these 2 rail crossings. Now, for Mr. Chen will answer the other questions. I have so many colleagues here. They will know better than, they have more experience than me in answering this question. I could refer questions to them. I am free to do so. Please, please allow officials on stage to answer questions. Let me first give you some figures. Just now, we're talking about the place of origin, right? For people coming through Shenzhen Bay to Hong Kong, in the past 2 days, On each day, there are about 10,000 people. That's Shenzhen Bay. Lo Wu, in the past 2 days, on one day, there are over 20,000, another day, over 10,000. So you can't just look at the figure of a single day. And if you're talking about the average for the whole of January, Lo Wu on average, $40,000 per day. Lok Ma Chau, 36,000. Shenzhen Bay, 34,000. So still, you look, if we talk about average figures, Lo Wu and Lok Ma Chau are the busiest control points. The Shenzhen Bay definitely is not the busiest one. But then on each day, the figures may change. It's inevitable. So therefore, when we look at the figures of arrivals from the mainland, now we have taken all these consolidated measures. It's like after we've implemented the first phase of the consolidated measures, there's been a drop of 60% in the overall figures. We mentioned that earlier. And we believe if there would be a similar trend this time round with these latest measures, then there could be corresponding drop in figures. Last question. Mrs. Lam, I'm from cable TV. Now that we are still seeing the spread of the disease here in Hong Kong, but there's still 2 BCPs not to be closed. Well, if you said that the Immigration Department could exercise discretion in dealing with mothers who are not Hong Kong residents, so why can't you accede to what the public have generally demanded, that is limiting people from the mainland? Now, the healthcare workers started a strike, and then you say the additional prevention and control measures have nothing to do with their strike. Yesterday, the alliance invited you to talk to them, but you refused. So is it the case that you would not listen to whatever they do? You just do your own things? Now a question for Dr. Tony Kuo. Today, certain healthcare workers are on strike. Now some private practitioners has indicated they are prepared to help out at the public hospital. So have you now assigned them to different wards, and what exactly can they help out with? And then there's news that by tomorrow, certain surgery nurses or healthcare workers providing emergency services may join the strike. So would they help private practitioners help with such surgeries? What if there is any incident and they are not HA staff by nature? So who would be responsible for that? And so far, how many patients have been affected by the strike? Can you give us some concrete figures?
I will only answer you about the question of meeting with the trade unions. Dr. Tony Kuo has agreed to a meeting with the trade union yesterday. I believe that it is appropriate for the Chief Executive of the Hospital Authority and to meet with their staff. I think that's appropriate arrangement. About the number of patients being affected by today's strike, I will first answer you about the private practitioners offering for help. We appreciate the offering of help from private practitioners and nurses. We are doing matching up exercises. They have different expertise and experiences. We are going to assign them to appropriate positions. This is ongoing. And there are retired colleagues helping us through in a part-time manner. And they are hospital authority staff, so they are going to be protected. And of course, we will give them training about controlling the disease. I don't have the latest figure, but as of noon, about 2,000 something medical staff joined the strike. It did cause and effects on us. The areas affected are specialist departments and also outpatient clinic. We have seen about 50% reduction of those services. And there are many nurses in the surgery departments joining the strike, so it poses difficulty for us to carry on with surgeries. For cardiac surgeries and other kinds of surgeries, we need to reschedule them. And for ICUs, pediatric wards, and other wards, there are serious shortages of staff. We are very concerned about the situation because those services are very important. Patients may be put at unnecessary risk. We rely on the colleagues who are still at work. We would redeploy them. Of course, we appreciate the help. Some colleagues come back to help even when they are on leave. But the situation is serious. So I strongly urge colleagues who are on strike or thinking about going on strike to stop. I understand that our colleagues are very concerned with combating the disease, but please do not express your views via strike because it really affected our services. There are many colleagues in the radiology department who joined the strike. So besides non-emergency services, supporting services to non-emergency services are also affected. In combating the disease, we need to do X-rays and CT scans for our patients. But without the staff, we have difficulty of providing these supporting services. And we have a serious shortage of staff in isolation wards as well. Of course, we would redeploy other colleagues to isolation ward, but you have to understand it is very risky to redeploy other colleagues to isolation wards in short notice. So again, I urge our colleagues not to use strike as a means to express your views because it will pose a risk to your colleagues and also the patients. We are facing a dire situation. So I hope our colleagues and the society would understand our hardship. And if the situation continues beyond today, we may not be able to maintain provision of our services. Of course, we are doing whatever we can to minimize the influence. We are rescheduling the non-emergency outpatient clinics and to streamline the procedures. And if the patient's condition is stable, we would give them more medication and reschedule their follow-up. And just now, like I said, we thank private practitioners for their help. But you must understand, private practitioners who come to help in short notice cannot replace our colleagues immediately because the environment is different. We give top priority to maintaining the provision of our service. This is a very critical time. And we hope all our colleagues will stand united to battle the disease. This is the end of today's press conference. Thank you.